Welcome to Science Easy Tech channel. In this video, we are going to discuss about techniques of communication, which comes under the subject communication and education technology. This video will be useful for Bsc Nursing second year students. Before moving on to the topic, if you are new to Science Easy Tech channel, just take a moment to subscribe our channel and also to press the notification bell icon in order to get connected with our latest updates. Already we have posted many videos related to nursing subjects as well as intermediate science subjects. If you have not watched those videos, the link will be provided in description box as suggested end card and iCard, or you can watch our channel playlist for more videos. Let's move on to the topic. So this is the last part in communication process, that is techniques of effective communication. Already we have discussed what is communication, what are the elements of communication or channels of communication, what are all the various barriers for communication, and how to overcome those barriers in my earlier videos. And this is my last video with related to communication process, techniques of effective communication. What are all the aspects or techniques we can use in order to promote the communication process or communication? So to improve our communication skills, we should have some certain skills with regard to conversation, with regard to listening, with regard to technical skills. Let's see one by one. First is conversation skills. So under this, focusing. So you have to focus on a particular topic. Sometimes if the other person is going away from the topic, you have to again focus on to the particular aspect of discussion. Next is paraphrasing. So when the other person is talking, you are going to repeat the same thing in a simpler using simple words in a simpler form to promote that you have understand better what the person is saying, so that the person also has a clarity that the other person who is listening understands the same. Suppose if he is going to tell something in a vague manner, you are going to use some simple words in order to make the understanding or the topic for clear understanding. Next is sharing information. So how you are going to share your own information with the other person, and communication is nothing but sharing information among people. So providing information what you are knowing. Okay. Suppose you may know some different things what the other person may not know. In such a case, you are going to give more information about a particular aspect. For example, suppose if in a hospital particular facility is not there, what are all the other hospitals which are providing that particular facility with regard to treatment or with regard to diagnostic things, and you can refer to them. Next, asking relevant questions. So when your topic is focused, for example, you are collecting history collection notes and you want to know about the disease condition, so your most of the questions are going to be with related to getting information about that particular disease condition, what may be the etiology or risk factor for getting that particular disease, like that, and all so much things. Next is clarifying and summarizing. Suppose if you have any doubts also, you can clarify your doubts. That's why even in practice teaching also, we will ask the student teachers once again, they have explained everything, they will finally the session is open towards the audience and they will ask whether you are having any doubts in order to have some clarification. Suppose if you are not clear with particular aspect, you can ask the person to clarify the doubts. And finally, it is the summarizing part. Summarizing means again you are summarizing the whole thing what you have discussed or what you have talked or what you have taken for the class, whatever it may be. Next is sharing humor. So communication always, if it is going to be some monotonous, it is going to be of no, yes. So yes, some jokes or some humor sense is very important in order to make the communication more and more effective, like that. Next is listening skills. Active listening. Active listening is very important. So if you are not going to listen properly, you are going to lose the information, and again it is going to be a biggest barrier for communication process. So you have to be very active in listening and using silence. So suppose when the other person is talking, you maintain silence so that you can listen more effectively, and also you can grab the things. And silence, so there is a proverb also, silence speaks more than words, and speech is silver, silence is gold, like that. So many proverbs are there. Then listening with a purpose. Suppose if you are going to attend a class, for example, if you are going to attend a class on financial planning, you have a purpose, so you have a goal for that particular thing. Similarly, in a nursing program, if you are going to attend a class, so what is the ultimate goal in order to achieve the graduation? You are going to gain knowledge on that particular aspect, so that you can serve the humanity, and it is going to fetch you job, like that and all. So always listen with a purpose. Acknowledgement of a message what you have received, whether you have received it correctly, whether you have attained the message clearly, whether you have perceived the message clearly, and finally giving feedback. So once you have understood the message and you are giving the feedback to the particular thing. Suppose we are taking a lesson practice teaching, and at the end of the thing we are asking the feedback from the students. So whatever they are, whether they have understand it or whether they have any doubts, and whether the teaching some aspects they have to improve, like that. And also in the feedback thing you can tell that in such areas we have better clarity, in such areas we need additional information, your teaching can be like this, your teaching can be like that, and all. You can give feedback. So it is just I am relating it to teaching aspect, but it is not in teaching aspect for anything. Even if you are telling some instruction, if you are giving some instruction, whether it is understood by them, you have to get the clarity. So whether the other person is sending the feedback, so that and all is very very important in listening skills. Next is technical skills. Technical skills is using a touch. So using touch, it is going to provide some comfort and some confidence to the other person. A gentle warmth touch is very very essential in order to make the communication more effective. Using non-verbal cues. So non-verbal cues is also more important. So your facial expression, your eye contact, then the mannerisms, everything is going to play a very vital role in order to making the communication more effective. And sharing of your feelings, your opinions, your attitudes is also going to promote the communication. And sharing your observations. For example, if you are asking how are you and the patient is telling I am feeling very very happy, but the patient's face is looking very very dull, means you can tell you are telling you are very happy, but when I am seeing you, you are not that much happy and your face is very dull, very sad, like that. You can share your observations to the other person to make the thing more clear. Next is sharing hope. So give a confidence, hope. Some patients may think that their life is hopeless, useless, they will be feeling very much guilty. So that time you have to give them psychological support, you have to give them hope, everything. Then presenting reality. Okay, don't give any false reassurance. Tell what is the real situation as it is. So sometimes it may be very difficult for doctors and nurses to tell the reality, but as a doctor, as a nurse and all, no, you should not give any false reassurance or false hope to the patient. Suppose if the patient is going to die within 2 or 3 months, you should not tell that nothing will happen and you will be living for life 100 years, like that. And also you have to tell the reality in such a way that this is the scenario. It may be extended, or it may even it may or may not be extended, your lifetime span, like that. And all you have to present the reality of the situation. Next is sharing empathy. Empathy is very very important. You should know the difference between sympathy and empathy. Okay, empathy is you are seeing yourself in that place and you are feeling for the person. So the sharing empathy is very very important. So in nursing qualities also we will be telling a nurse should be empathetic. Okay, so in such a way. So these are all the techniques of effective communication we have seen under the following headings: conversational skills, listening skills, and technical skills. Hope this video is clear for you all. If you like my video, please don't forget to give a thumbs up, like and share and subscribe to Science Easy Tech channel. My previous videos link, as I have told you earlier, I have given in the description box, suggested end card and iCard, or you can watch our channel playlist for more nursing related videos as well as videos related to intermediate science subjects in Tamil. Thank you friends. Keep supporting to Science Easy Tech channel.